Oh my gosh. 2 lines. Positive.
Teen pregnancy is a common struggle among Latinas. In Santa Clara County, Latina teens have the highest rates of teen pregnancy and teen birth rates. Teen birth rates are the highest in South County, in parts of East San Jose and Central San Jose.
I don't know what to do.
Most teen girls are confused and scared when they become pregnant.
The individuals in our Latino community, and particularly women, have the highest rates of being uninsured, the highest rates of not having access to health care. And I think there have actually been campaigns by crisis pregnancy centers that seek to target the Latino community specifically, and Latina women specifically, with special advertising and different kinds of information for them. One of the stated missions of crisis pregnancy centers is to stop abortions at all costs. And so as part of that mission in practice, many of these centers give people misinformation about what an abortion is. They give people misinformation about the medical outcomes of an abortion. They've often, for example, said that abortion may cause breast cancer or causes infertility, which are things that have not been found to be true about abortion. What I think we can do for those young women who face unplanned and unintended pregnancies is support them in understanding all of their options in terms of dealing with the pregnancy. So whether that be keeping the pregnancy and supporting them in continuing to receive an education, to find employment, to have support for their families. I think that's really important. If they seek to terminate their pregnancy, to support them in that option and to have those options for them available is really important. I think in terms of preventing unplanned and unintended pregnancy among Latina teens and teens in general, I think a lot of the things that we can do are to promote sex education that is comprehensive, medically accurate, and age appropriate. One of the things that Latinas and others can do in support of, or actually, to combat some of the problems of crisis pregnancy centers, is to be, educated about what they do and to make sure that your community knows that there are options for them that have, that provide more full options for healthcare than these centers. I think another thing that we can do is to look at legislation that is happening both locally and at the state level around this issue. There's a piece of legislation right now going through the California Senate. It's an Assembly Bill 775, called the Reproductive Fact Act, which will make it so that when people come to these centers, the center will have to provide them with a referral or with information about another place where they can get the health care they need if the center isn't able to provide that. And then the third thing I think that we can do to combat some of the misinformation and the misdirection of crisis pregnancy centers is to, to just make sure that as we see in our communities that there are initiatives to support full access to health care for people, that we get behind those, that we talk about the fact that all of our community members, including our community members who are uninsured, that they have access to services, and really, becoming a kind of citizen activist around the issue of access to health care for people in any way.